everyone, I'm MassLive reporter Melissa Hanson. I'm here today with Worcester District Attorney Joseph Early and author Sam Quinones to talk about the opioid epidemic. Quinones, who is joining us virtually from California, has done extensive research on this topic and is the author of the book Dreamland, The True Tale of America's Opiate Epidemic. Locally, District Attorney Early has been working to address the epidemic, including the formation of the Central Massachusetts Opioid Task Force. District Attorney Early and Sam, how would both of you categorize the current state of the opioid epidemic?
Sam, you want to go first? Or?
No, go ahead, Joe.
Okay. Melissa, it's a unique thing, and I think we share a lot of the same ideas insofar as the pandemic has taken basically what is a very complex disease, treatable disease of the brain, and thrust people who use into even further isolation when the drug itself does push people towards isolation. The CDC has told us that we may have upwards of 86,000 people who died between July 1st, 2019 and July 1st of 2020. And Sam and I were chatting a little bit earlier. Sam mentioned that number might even be over 90,000 people. So I think from my perspective, this pandemic has just exacerbated this, and stigma is a huge part of this. And if this were any other treatable, relapsable disease like heart disease or diabetes, people would be screaming, knocking down doors to say, hey, we've got to do better.
Yeah, and I would say that predating even the pandemic is what, as Joe said, it's been a enhancer of this problem. It has left people isolated, people in recovery. The one thing they tell you in recovery is don't isolate. That's why, you're trying to recover from drug. And so that is exactly what you've had to do. A lot of people have been left on the street because there's no place in the jail for them. And so they've been dying too there because of I think what predated though the pandemic was a transition, kind of a transition towards very, very potent street drugs that are synthetic, primarily, of course, fentanyl and methamphetamine. These two are now seen in quantities that we've never, ever seen synthetic drugs. Synthetic drugs meaning drugs that are just made with chemicals, other chemicals, and not with anything that grown from the ground or a plant or anything like that, like marijuana or what have you, cocaine, heroin. And so these drugs now are extraordinarily potent, extraordinarily cheap too. And that was building well before the pandemic. But of course, with the pandemic, people are alone with these extraordinarily dangerous, deadly drugs. And that is the other thing that has kind of made this the last year or so even more problematic, because, there's just no backup for folks now a lot of times. And that is really an issue that we're seeing in the death toll that Joe referred to, which I'm pretty sure is going to be close to getting close to 100,000 for the year 2020 once we fully count all the numbers and all that. It could be a record number. It'd be far more than the previous record.
As we start to see vaccinations amp up and slowly moving back toward normal life, how long is it going to take for people who struggle with addiction to recover from just the setbacks that the pandemic has brought on the opioid epidemic?
That's a real good question.
Yeah, I would say that's a very good question. I'm not sure anyone has a good answer to it.
No, I mean, I got my first vaccination. I felt some elation. First of all, the people who are in recovery have a way to navigate the system. Those who are using and who haven't started their recovery process yet, are they going to be able to get that shot? I mean, Medical Steel and some people doing some great stuff here to get the shot out to the homeless. Boy, that's this, like Sam said, it's a lot to be determined there.
Sam, anything to add there? Any other thoughts?
What the pandemic the pandemic did two things, it seems. One was positive, one was extraordinarily negative. The negative was to create the conditions under which the opioid epidemic got going in the first place. In my reading, my reporting, and my writing on this, I really connect the opioid epidemic to our own isolation as a culture of isolation, people all alone, people even in wealthy areas or poor areas, it doesn't really matter. Everyone's alone, everyone's in their houses on the screens and so on. And then a lot of areas where this was the worst, the first places that were worst hit were areas that had gone through a lot of economic devastation. Well, what does the pandemic do but come along and create more isolation? A lot of people lose their jobs or furloughed or what have you. And so you get this problem that kind of replicates what we saw in the 90s, early 2000s that created the opioid epidemic. However, I would also say this, and I think that this is where I find hope in what's happened in the pandemic, and that is that it has also created, I'm hope, among a lot of us, a renewed appreciation for community, for being what we hated being alone. We hated being cut off from others. We hated not being able to hug people, even acquaintances, you know, and we saw that this was that we were now connected to the most vulnerable. We are connected to that grocery store clerk who has to come to work whether or not she has health insurance. We're connected to that meatpacking worker in Kansas who is cutting up the meat that we then eat and may or may not be able to come to work or may not have health insurance. We are connected. So it's showing us the importance of community. It's showing us the importance of that we are all connected to the most vulnerable among us, you know, and I think that's a lesson that we can't, it'll only help us to learn over and over and over again. And maybe we will see post-pandemic, we'll find a new way of relating to people. I was talking earlier, Joe and I was saying that one of the things that may also happen is we'll see commute times drop considerably because people now are going to be working more from home. I certainly hope that's the case. Commuting is one of the worst things that does most to destroy community feeling, because you're on the road all, you know, too much of the day, you know, and if you can spend that time at home more of the week, I think that adds for happier families, happier neighborhoods, more unified neighborhoods. So I think that there are some positives that come out of this, as devastating, of course, as this has been for the whole country.
District Attorney Early, how has the work of the Central Mass Opioid Task Force changed during the pandemic?
Well, it's changed in quite a lot of ways. When we first started, you know, bringing people together, when we first started, we were raising awareness about opioids. We were raising awareness about the problem. And it seems like we've grown a lot during the pandemic. We're over 700 people strong. And one of the big things, like when we attended the Prescription Drug Abuse and Heroin Summit last week, and we've been pushing and promoting, is the reduction of stigma. And it's interesting that 50% of the public at large will think that this is a moral failing, weakness, a character flaw, when the smartest medical minds in the country are telling us that no, this is a very treatable disease, a very treatable and complex disease of the brain. And if we treat it like we treat diabetes, like we treat heart disease, we're going to be better off. And Sam and I were talking a little bit about this earlier, that if we get these conversations, so it goes back to Sam's concept of community, and I think he's right on the money there. I remember this horrible feeling I had about a year ago. I was out in my driveway working from home. I had two of my children, and we were talking, but you felt like you had bars. You were in a prison cell, but you weren't in a prison cell. So now, that whole year, we all of a sudden, you don't have community during that period of time, but now you have the opportunity with the shots to get community again. You know, maybe we'll get outside the doors like Sam had suggested. Maybe we'll go, you know, see how our neighbor's doing a little bit more. Maybe there's an opportunity, and with that opportunity comes the opportunity to reduce stigma. And when you understand when we're all in this together, and I get into politics because of my dad, who helped a lot of people, but this is what good government is becoming, helping others. Maybe, and I paid more attention to simple things like saying hello to people, because it offers you a pathway into their world, and at the same time opens up a pathway into your world, which is a huge part of community. And if we can come together as a community to reduce stigma, reduce the understanding, the misunderstandings, I think we're going to be better off. But that's how the pandemic has changed the focus of the Central Mass Opioid Task Force. It's just been evolved in an incredible way, which you never could have thought of without this pandemic. Of course, when we started, a few people were wearing masks. Now it's normal for everyone to be wearing a mask.
Yeah. Speaking of stigma, what improvements have you seen in that area in the recent years, and how much further do we need to go to reduce stigma more?
From my perspective, if you listen to Secretary Collins from the NIH, Dr. Nora Volkoff from the NIH, who's head of addiction services, she was on 60 Minutes, and she came out with things like, if you go to the emergency room on an overdose, you don't leave with the treatment plan in place, it should be medical malpractice. Now, that's a doctor saying that. But Sam, just a few minutes ago, talked about the need to melt stigma away through conversation. Sam, I don't want to steal your words. Maybe you can talk about that, because I learned something during that discussion. Geez, he's got a point there. I haven't heard this, being 10 years down at the prescription opioid summit and heroin abuse summit. But that's a point. When we step out of our silos and share stuff like that, I think we're better off. And Sam, you can speak to that. I thought it was your idea, and I think that's a great idea.
Yeah, I mean, I think that the more we tell the stories of addiction, the more that stigma fades, and the more different people tell their stories. So it's not just a few people. It's everybody. It's in a lot of different walks of life. And I think before the pandemic, that was happening. That was beginning to happen. And I saw it with my own book. I remember writing the book, thinking and finding a complete silence surrounding this topic. I mean, just unbelievable. So I was stunned. And as time went on, published the book, time went on, I began to see more and more people coming out of their shadows. A lot of times this was family members or recovering addicts themselves or what have you. And the more people do that, I thought that was actually, we were making some strides there as a country. And I'm hoping now with the pandemic, hopefully we'll see winding slowly down, that we will see more of that. That we'll have a deeper sense for the importance of most vulnerable around us. I hope that the pandemic will have taught us that. That's one of the lessons that we can pick up. It's also applicable to the opioid epidemic too, seems to me. They're not so separate. They're very, in fact, connected, because they come from some of the same places, and I think we can find in what's to come a feeling that, yeah, okay, we're all kind of more in this together. It seemed to me that one of the crucial problems of American culture was our isolation. We're all kind of like just in our own little worlds, in our own little bubbles, and didn't hang out or didn't know too many people who weren't like us and that kind of thing. And so I'm hoping that this will all kind of combine as time goes on to have more to be a more powerful force for reducing what Joe was talking about earlier, the stigma of addiction. I think it's an important thing to work towards.
Yeah. Sam, your book came out in 2015. How has the epidemic shifted since then, and how has your research changed?
Well, certainly the epidemic became, as I said, more about synthetic drugs. It went from, the purveyors, if you want to put it that way, of the problem drugs were at first, the origins of all this began with doctors, pharmaceutical companies, doctors, some being pushed, some being embracing very quickly the whole idea that we need to make vaster use of opioid painkillers for all manner of pain, and not really paying attention to who the patient was, or the background of the patient, anything like that, and with enormous amounts of supply. Well, that created the addiction to pills, and then led to heroin. And what's happened since then, as I said, is that the underworld has taken the place of those doctors and as the suppliers, and they've switched now to synthetic drugs. And so that is really the story, if you ask me. Methamphetamine and fentanyl. I would say, though, too, that in my research, what I have taken to looking into, and I have my follow-up to Dreamland comes out in October. One part of that book will be about the neuroscience, that we now know so much more about the brain than we've known ever, and it is there's huge volumes left to learn still, but we do know a lot, and it's a remarkable period to be alive, when you can ask questions like, what does your brain look like on prayer? You know, what's going on in your brain when you're praying? What goes on in your brain when you're curious? You know, what goes on in your brain when you're virtue signaling? What's going on in there? You know, we can answer a lot of those questions. And so I spent a lot of time trying to understand the addiction, the neuroscience of addiction, and how that then also connects to what we're seeing out there in our society. How many things are legal that are hitting on those receptors that can lead to addiction? Sugar, social media, pornography, video games, you know, on and on and on. There's a lot of that does nothing, is completely illegal stuff, and it also primes us for addiction. So these are some of the things I've been kind of working with. It's been very interesting. It's completely unexpected. I didn't know that I'd be here when I started my books back in 2012. But it's certainly been a long, strange trip, and very, very interesting.
How does Massachusetts compare to other states as far as the severity of the epidemic here?
I would say equal to some of the worst. You know, that's my impression. One thing that Massachusetts did not have until recently was methamphetamine. And methamphetamine, you would not think of it part of the opioid epidemic, because opioids are depressants. You know, they dull you down, you numb you out, and methamphetamine hypes you up and keeps you up for days. But I believe they are absolutely entwined, and that's because a lot of the market, the new market for methamphetamine in America today, very often now, in state after state after state, is people who were on opioids. And they may be still using opioids. They may still be using Suboxone to control the cravings, which is an opioid itself, but then using methamphetamine. So I would say that it seems to me that there's a significant problem, have to say, in Massachusetts, which has been added in the last 2 or 3 years, the new supplies of methamphetamine that have been produced in the Mexican cartel world, that have been inundating the rest of the country for the last several years, and only now in the last, I would say since 2018 maybe, arrived in New England.
District Attorney Early, what have you been seeing in those terms in central Massachusetts, the shift to synthetic drugs, and how does it affect the work of your office?
Well, we started to see a decrease in cocaine. We started to see cocaine going down, cocaine use going down, but now it's come roaring back. And it seems like a lot of the cocaine now is being cut with fentanyl. And we know fentanyl is 50 to 80 times stronger than heroin. And when you do get people using cocaine that's laced with fentanyl, you know, the cocaine itself won't be as addicting as the fentanyl. And you bring people into the synthetic market, and they get this addiction to the fentanyl as well. And there's a greater chance of them dying. Like Sam said earlier, don't know any long-term fentanyl users. And methamphetamine scares the hell out of me. We're starting to see more methamphetamine than we ever saw before. And this is the type of stuff that can be made cheaply. And as it's being made, it's got a recipe for disaster, because it hadn't touched Massachusetts like it had touched other parts of the country. But when you get people addicted to methamphetamine or using methamphetamine, the results are devastating.
What would you say, in your opinion, is the best tool to addressing the epidemic and to getting help to people who need it?
Compassion. We've got to show more compassion for people. We've got to have a greater awareness and understanding about the disease. You know, we've got to get the word out there that this, look, the smartest medical minds in the country, if not the world, Francis Collins, Dr. Volkoff, Surgeon General Vivek Murthy, tell you that this is a very treatable, complex disease of the brain. I mean, we've got to get the message out there that you've got to treat. You can't go to an emergency room and get scolded. You know, do they ever do that for heart disease, where you show up with heart disease or you're overweight? Do they say, bet you wish you exercised a little bit more and had a few less pizzas? No, but they do it routinely. And what was surprising to me is that even a lot of the people in the medical profession had to become aware of words and terms and not stigmatizing people. So I think compassion, and then some empathy thrown on top of that. And understand that drugs such as methadone, Suboxone, and Vivitrol do work. They do work, and it's not trading an addiction for another addiction, because the people who get on methadone, they get on Suboxone. I mean, as Dr. Ruth Pote said once, you guys see the train wrecks. You don't see the nurse or the accountant who gets up in the morning, goes and gets her methadone, comes back home, cooks her kids, feeds her kids, puts them on the bus, goes to work, picks the kids off the bus, has the kids do the homework, feeds them, and puts them to bed, and then's right there the next morning getting her methadone. You just see the train wrecks. You see the people that you know, come looking disheveled, looking like life is just set on them with an 800-pound weight. But you got to understand that some of these treatments, and there's a big dichotomy in the community when it comes to treatment. Some people will tell you, especially in AA, you can't be using anything. That's just treatment. People in recovery actually don't use drugs to help get through. So, that's something that's been brought to our attention. But I think there's a room for everyone, and there's a room for different solutions. No one size fits all.
Sam, what do you think?
I think that there's a lot of ways of moving forward on this, and we know a lot of them. And what I guess I've been finding that interests me or encourages me is that there's a greater willingness to look beyond what we've always tried and new approaches. We were talking earlier about new ways of running jail. A traditional jail is one of the greatest contributors to mental illness, addiction, and criminality that we have. There's nothing really good about, and so rethinking how jail can be done, particularly with regard to how recovery can work in jail. It's like these kinds of really interesting new approaches that are being tried. And I would say one of the things that has struck me, frankly, has been very, very interesting to watch, is how nimble and innovative and open to new approaches law enforcement is. In fact, I would say they're one of the real pioneers in innovation in this. Because I think they saw, a lot of folks in law enforcement saw that doing things the old way wasn't working. They learned, I think, a lot of what not to do during the crack epidemic, frankly. And to me, that made we've watched that kind of take hold, and you're seeing this all across the country. It's a new approaches are not, you can get elected in Republican areas. I think somebody's talking somewhere. You can get elected in Republican areas in many parts of the country without saying we just need to lock them up and throw away the key. There's a whole different way of thinking now in a lot of red areas of America. And I think that is actually a fascinating thing to watch.
It looks like we might have lost the district attorney there, but you were just mentioning innovation with law enforcement. Can you give us an example of what some of the innovative practices you've seen are?
Excuse me. Yes. Well, one is this new approach to how jail is done. In my next book, I've got several chapters on that. I would say that is huge. I just think that is such a big deal. When you can start thinking about jail in a different way, start thinking about jail as a place to begin recovery instead of a place to vegetate until it's time to be released, and you leave the jail at least as bad, or if not worse, than you were regarding your mental illness or your addiction or whatever, as you came in. To me, that's a remarkable shift, and has only been on the last few years that we've seen that be tried in many areas. I think Massachusetts got several examples of this. I know Ohio and Kentucky also do. I think there needs to be a change in that entirely. I think the acceptance of recovery courts or drug courts increasingly all across the country by judges and sheriffs and police and so on. I think that is and probation officers in particular is enormously important. That was going on before the epidemic, but it really took off. The numbers have increased enormously. I'm going to be speaking in a few months to a convention of drug court administrators in DC, and I think that's one of the great things that we've watched in the last few years is an acceptance. And then, of course, once you get more people involved in it, you get more people tinkering with how might we do this and what can we do this a little bit differently here and there. And then that's when you start to get innovation that's very, 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 very interesting, I think. I also think in some departments, and I don't want to exaggerate this too much, in some departments, police departments, particularly narcotics departments, there may be a reassessment of how to use confidential informants. Confidential informants are essential if you want to take down large drug rings. But frequently confidential informants are drug addicts, and they are the general idea is you want to get away from them as a department because they're a pain in the butt to deal with. But I think in some departments, I'm hearing the attitude that maybe we need to, instead of just cutting them loose and letting them go back to their drug world, maybe we need to find ways of getting those confidential informants into treatment. And I think that too is something that I think is just a totally different change. This epidemic has been forcing us to question a lot of things about how we live, policies, budget, on and on and on like that. And I think it's a very, very, that is the silver lining to an otherwise devastating national saga.
What advice would both of you give to someone, a family member who's trying to help a loved one who is struggling with addiction?
Locally, we're blessed. I mean, you got Chris's Corner down in Milford. You got Joanne Peterson, who really is a savior. She's an angel. Immediately, if you got someone you don't have answers, call Learn to Cope. Call them immediately and just look. They're going to let you know you're not alone. Joanne Peterson started this program after one of her sons was given an OxyContin by a responsible adult at a graduation party. But we've also got the Mass Substance Use Helpline at 800-327-5050, and it connects patients to programs, treatment programs that are right for them. And we've also started in 17 cities and towns. If someone gets arrested, we immediately give them an opportunity to get treatment. We postpone their arraignment so they don't go to get a record. These are the type of things that work. But call Learn to Cope. Look at the resources on our office webpage. There's a lot of people out there in the same boat as you. There is help out there.
Sam, any general advice that you think is helpful for people?
Yes, I would say do not be isolated. Do not remain alone thinking, first of all, that you're the only one, or be ashamed that your son or daughter or husband or uncle or grandfather or whatever it happens to be is. I would say there are lots of people out there who want to help, can help, lots of approaches that can help, and you will feel energized yourself when you connect with these groups, people, organizations, what have you, sometimes churches, whatever it is. Do not sit alone in the dark. That is really the main thing. It's not a good idea. It doesn't help you. And don't try to do it yourself all alone, because that was what parents faced 8 or 10 years ago. And I've talked to these several parents like this, where I didn't know what to do. Nobody knew what to do. It was nobody I knew had any experience with this. They thought, And so I just went out there and started swinging away and made lots and lots of mistakes. There's no need to reinvent the wheel here. You can find people in your community or certainly in your state that you can go to and you can ask basic questions of, and you can figure out game plans. And to me, that is also like another transition or transformation that we've seen in this country, where now there's all these mentors around, there's all these people who can help, who can give you good advice and may be very helpful in your specific case, but just don't sit alone. Don't. That is really not where you want to be. That's that will create more heartbreak than anything.
And they can also, Melissa, they can also join our task force, you know, because you're going to run into people in the recovery community, faith-based community, private community. And faith-based is a big part of Sam's book that's coming out October 12th, the least of us. But you can join our task force and come in contact with all of these people who share the same passion. And I mean passion for you, with you, to get us out of this problem. And that's the biggest thing. If you've got a passion for it, if you've got energy, you know, come join us. You know, we're all in this together.
All right. That's good to know about. I think that's going to reach our time limit for today, but thank you both so much for joining us, and thank you to the viewers who tuned in. I'm Melissa Hanson from MassLive. We'll see you again later.
Thanks a lot, guys.
Thanks, guys. Take care.